Dr. Wan Rizal.
Mr. Deputy Speaker, when Singaporeans hear about greater use and sharing of health data, their first reaction is rarely about system architecture or data flows. Their concern is much simpler, it's much more human, and they ask, can this information be used against me? Will it affect my job? Will it affect how I am treated? I hear this from workers, from our seniors, and from caregivers alike. Many residents, especially older residents managing long-term conditions, worry about who can see the information, whether consent is meaningful, and what happens if something goes wrong. These are legitimate concerns, and I know that other members will address them in detail, particularly on systems, safeguards, and patient protections. As a Labour MP, I rise today to focus on a pillar of this bill that is essential to public confidence: worker trust, and in particular, the safeguard that disallows health data from being accessed or used for employment purposes. So for workers, health data does not exist in isolation. It intersects very directly with their livelihoods, with hiring decisions, job retention, access to work opportunities, and sometimes continued participation in the workforce. This applies not only for traditional employees, but also to self-employed persons, platform workers, whose access to work can be more fragile and more easily withdrawn. Now, in this context, the imbalance of power is real. When income and job security are at stake, workers often feel they have little room to refuse disclosure, even when they are uncomfortable. And that's why legal safeguards matter, not just in theory, but in how workers experience the system. This is why I want to state clearly and on record that I strongly support the safeguard in this bill that disallows health data from being accessed or used for employment purposes. This safeguard is not free-for-all. It is central to whether workers trust the system at all. So why is this system so important? Some may ask why this needs emphasis, since the safeguard is already existing in the bill. The reason is not legal, it is behavioral. Even the perception that health data could affect employment decision can discourage workers from seeking timely care, disclosing relevant information to healthcare professionals, or participating fully in national health initiatives like Healthier SG. This would undermine the very objectives of this bill. Workers should never have to weigh their health against their livelihood. If this bill is to succeed in improving continuity of care and public health outcomes, workers must feel safe engaging with the healthcare system without fear of downstream consequences of work. Now, this concern is especially relevant for protected characteristics and disabilities, including mental health conditions. I want to be clear, I'm not suggesting that any one type of health condition is more important than the other. But from a workplace fairness perspective, some type of information are more likely to be misunderstood, stigmatized, or misinterpreted in employment contexts. Mental health conditions, for example, are often less visible, episodic, and poorly understood in workplaces despite progress over the years. The issue is not the data itself. It is the risk of unfair treatment if such information is misused or even informally taken into account. This is precisely why the employment use safeguard is so important. The labour movement has long stood for the principle that workers should not be discriminated against on the basis of protected characteristics, including disabilities and mental health conditions. The safeguard in this bill includes specific prohibitions on NEHR access for insurance and employment purposes. It reinforces, in the context of health data, the same values we have already affirmed as a society, that personal characteristics and health conditions should not become barriers to fair treatment at work. Seen in this light, this safeguard is not an additional demand. It is a logical extension of principles Parliament has already endorsed. Workers are also concerned about indirect or backdoor use of health information. not necessarily through access to records, but through fitness of work assessment, third-party requirements, or other channels that could influence employment outcomes. I note that the bill identifies specific statutory medical examinations or SMEs where NEHR access is permitted, such as pre-enlistment checkups or assessment for vocational driving licenses. These are strictly defined to prevent harm to the individual or to public interest. I seek the Minister's assurance that this list of exceptions will remain tightly scoped and will not be expanded to general pre-employment screenings without rigorous oversight. Furthermore, while healthcare providers can override an individual's access restriction during a medical emergency, the law must remain clear that data can still never be used for employment purposes. Mr. Deputy Speaker, I also want to speak briefly about healthcare workers, including members represented by the Healthcare Services Employees Union, or HSEU. Healthcare workers occupy a unique position in this bill. They are entrusted to access and handle sensitive health data. They are required to do so as part of patient care, and oftentimes under pressure, and subject to, of course, significant penalties if things go wrong. From a labor perspective, safeguards must protect not only patients, but also the workers tasked with implementing the system. I hear you. Accountability is important, and willful misuse of data must be dealt with firmly. But accountability must be fair and also proportionate. We must distinguish between intentional wrongdoing and inadvertent errors arising from system design or workflow complexity or even operational constraints. And this means we need to have clear role-based access, proper training and guidance, and supportive implementation, especially during transition periods. Protecting patient data and treating our healthcare workers fairly are not competing objectives. They must go hand in hand if the system is to function well. Sir, if I may briefly return to the concerns of my residents, especially those who are seniors and caregivers. Many seniors manage multiple conditions and interact frequently within the healthcare system. They worry about privacy, they worry about consent, and they worry about whether their personal information is respected. While I focus today on workers' trust, I want to assure residents that their concerns are also heard. Trust is the common thread, whether one is a worker, a patient, or a caregiver, or senior managing long-term care. When Singaporeans trust that their healthcare information is handled with care, strong safeguards, and clear boundaries, they are more willing to seek care, share information honestly, and participate fully in our healthcare system. Sir, please allow me to continue in Malay. Rang undang-undang ini mesti membina kepercayaan rakyat. Data kesihatan bertujuan untuk menjaga kesihatan, bukan untuk menjejaskan mata pencarian. Oleh itu, perlindungan yang melarang penggunaan data kesihatan bagi tujuan pekerjaan adalah amat penting bagi pekerja, pekerja sendiri dan pekerja platform. Tiada pekerja seharusnya berasa takut bahawa mendapatkan rawatan boleh digunakan terhadap mereka di tempat kerja. Perlindungan ini selaras dengan prinsip keadilan dan maruah di tempat kerja, termasuk bagi individu dan ketidakkeupayaan atau keadaan kesihatan mental. Apabila kepercayaan dijaga, pekerja dan warga emas akan lebih yakin untuk mendapatkan rawatan berkongsi maklumat kesihatan dengan jujur. Sistem penjagaan kesihatan yang kukuh bermula dengan kepercayaan, dan kepercayaan hanya wujud apabila sempadan jelas serta perlindungan tegas dilaksanakan. So, Mr. Speaker, with the right safeguards in place, this bill can strengthen healthcare delivery and public health outcomes. The safeguard disallowing the use of health data for employment purposes is a critical part of our trust framework. It reassures our workers that seeking care will not put their livelihoods at risk. It aligns with long-standing principles against discrimination, and it supports rather than undermines the objectives of this bill. At the end of the day, the healthcare system can only be as strong as the confidence that people put in it. When our workers, patients, and seniors trust their health data will not be misused at work or elsewhere, they are more likely to engage, participate, and benefit. Now, for these reasons, I support this bill and the safeguard it contains. Thank you, sir.